Ah, Good evening. Welcome everybody to this evening's Health, Housing and Adult Social Care Scrutiny Committee. Tonight we have some guests here who are going to talk. So if you need the toilet, they're just next door to this room. And the fire exit, if you follow any signs, if we have a fire alarm, but we're not expecting any. So we will need to exit if the fire alarm goes off. Thanks very much. Apologies, Councillor Smalley has been substituted by Councillor Cuthbertson, so welcome. And Councillor Wan has been substituted by Councillor Knight. Again, welcome, Councillor Knight. So nice to see you. Have we got any declarations of interest in tonight's business? Okay, Councillor Rose.
It's not a declaration of interest, but given that I'm a governor as a councillor on the York and Scarborough NHS Hospital Trust, that's a substantive part of today's meeting. I thought I'd mention at the start.
Okay, thank you very much. Very good. Have we all had a chance to read the minutes of the meeting of the 23rd of April? Has anybody got any points to raise about the minutes? Or can they be passed? So, anybody? Councillor Rose?
Not about the minutes here, which are accurate, no points from them, but obviously we haven't yet got the minutes from the meeting that we had more recently than that. But I was expecting the homelessness pathway item from that agenda to resurface at this meeting. So just wondering why it's not, and whether it's staff availability or whatever it is, and why it's not on the work plan provision. They either just
So the homeless pathway item has been sent by this committee to the Audit and Governance Committee.
The other homelessness.
Right, we'll have to wait because that did come up. I'll have to discuss that with the Democracy Officer, and I'll get back to you on that one.
Okay. Yeah, it's the one from the last meeting that we just gone.
Yeah, but these are the minutes of the 23rd and not the last minutes of the meeting. I think they're running a little bit behind, at the moment. I'm sure they'll be caught up by soon enough. Okay. So we're going now to public participation, and tonight we have two speakers registered to speak, one remotely and one in person. So we're going to actually go to the remote speaker first of all, and that's Flick Williams. Have we got Flick Williams? I think
yes,
that.
Good afternoon.
Evening, nice to have you here through the ether. So the score. You've got 3 minutes, and we look forward to hearing what you've got to say.
Elected members, you may recall I attended your last meeting to share with you my traumatic hospital experience in late April. For the benefit of your visitors and to refresh your memories, I shall summarise. I am clinically vulnerable and in the 5th year of the pandemic lead an extremely restricted life in order to remain COVID-free. I have multiple impairments, chronic health conditions already, and simply cannot afford the risk of long COVID if I wish to remain living alone independently. I and many others like me now dread any interaction with healthcare as it's simply not a safe place to be. A survey done by the organisation Clinically Vulnerable Families showed 54% of respondents had declined or delayed necessary healthcare because of the COVID risk. So my emergency admission in April realised all my worst fears. For context, I have no vaccine protection after an anaphylactic reaction to my first jab. During my week in hospital, 23.5 hours of it in A&E, I forewent any food, only consumed liquid when I could find an open window to remove my FFP2 mask, which I also wore while sleeping. All healthcare workers refused me the reasonable adjustment of masking, saying they were no longer required to do so, which is incorrect according to the patient charter. On the 4th day, I was directly exposed to an unmasked COVID-positive patient who was refusing to be confined to a side room. Conversations with some healthcare workers, generally the most junior, revealed they were deeply unhappy with the situation also. I quote, "We keep getting it because they aren't testing downstairs anymore, and we've all run out of sick days." The strong impression given was that none of them would be there if they had the financial option to be anywhere else. This is simply not sustainable from a staffing perspective, and the amount of hospital-acquired infection and preventable death is nothing short of scandalous. With the change of government, only time will tell if the minimising at a national level continues, because COVID is not now just a cold. It is a systemic vascular disease caused by a rapidly mutating virus that is showing ever more vaccine escape. Not that anyone can now rely on being vaxxed and relaxed with waning immunity and lengthy time lapse since the last universal booster programme. So whilst awaiting a government position, I respectfully asked where this lack of infection control and the abject failure to protect patients fits into your journey to excellence, particularly the work streams of safe staffing and fundamentals of care. COVID is not over. It will never now be over, as all the modelling was flawed and not based on novel coronavirus. And now it seems we're being psychologically prepared for the next pandemic. Good health is a temporary situation for everyone. Healthcare operating as the NHS currently does is fundamentally ableist, ageist, and arguably eugenicist. Whatever happened to first do no harm? Thank you.
Thank you, Flick. We'll take your comments into consideration and look into those for you. Thanks very much. Right, okay. The next speaker is Dr. Ernestine Z, and she is going to speak on the item number 5, breastfeeding and infant feeding. So, welcome to the meeting, Dr. Z, and when you're ready to start speaking, please go ahead.
So, thank you so much for this opportunity and good afternoon to all of you. I am delighted to speak to you on a topic that is very close to my heart, and that's infant feeding. As the first source of nutrition for newborns, infant feeding has a profound impact on their physical and mental development and our future society. Each infant feeding approach, be it breastfeeding and/or formula feeding, has its advantages and challenges. And choosing the best method for a child requires the parent being knowledgeable and able to make informed decisions based on individual circumstances and preferences. Whilst the benefits of breastfeeding has been widely documented, breastfeeding can be challenging, and some mothers may experience difficulties and hence requiring support. Formula feeding, on the other hand, is an essential nutrient and can supplement breastfeeding, but lacks the natural antibodies found in breast milk and requires careful preparation to ensure safety. This is why the World Health Organization recommends exclusive breastfeeding for the first 6 months, followed by continued breastfeeding along with complementary foods up to 2 years of age or beyond. Amidst economic uncertainty, with every family feeling the impact of rising cost of living, the importance of supporting infant feeding has never been greater. Breastfeeding is cost-effective and reduces expenses associated with formula, bottles, and other feeding supplies. Breastfed babies may require fewer healthcare interventions, hence reducing healthcare costs and improving health equality. Breastfeeding is also environmentally friendly, reducing waste generated by formula packaging and feeding equipment. In York, the breastfeeding rate at time of delivery is 74%, which demonstrates that most mothers are eager to provide their newborns with the best possible start in life. However, the rate drops significantly to 44% by the time babies reach 4 to 6 weeks old. This decline in breastfeeding rates highlights the importance of support education, and wraparound support initiatives. The report presented to you today by the Director of Public Health is just a start to what is really needed. The work I have been doing with stakeholders in Yorkshire and Humber highlights the need for stakeholders to pull together and holistically support infant feeding. Stakeholders like yourselves have a key role to play in infant feeding. We need to provide education, resources, and support structures for parents to make informed decisions, along with advocating for policies that promote health equity. This is the only way we can work towards a city of York where every baby will have the best possible start to life. This cannot be done without your support. Thank you for listening.
Thank you very much indeed, and for your comments, and we'll definitely take those into consideration. Thank you. Okay. So, we're going over now to item 4 on the agenda, which is York and Scarborough Teaching Hospitals and NHS Foundation Trust CQC update. And we have Dawn Parks and Simon Morritt from the Trust. So welcome to you both. Yes, you press the mic. Yeah.
So thank you for inviting us back to give a further update on our progress against the CQC reports that were published in the summer of 2023. This, I think, is our second visit to Scrutiny. Dawn has, I hope you've got both a copy of the report and some slides that accompanied the report. I wasn't quite sure whether the slides had made it through. It's Dawn's report, and I'm going to ask Dawn to walk us through. I think when Dawn was last introduced to the committee, she was interim chief nurse. I'm now pleased to say that she is the substantive chief nurse of York and Scarborough hospitals. It says designate, but she was successful in her interview a couple of weeks ago. So without further ado, I shall hand over to Dawn, who will walk us through the report. Dawn.
Yeah, good evening. Thank you for inviting us back. It's a real pleasure to be here with you. So you've got an overarching report there. I won't use that. I'm happy to take questions on that report, but we've got the slides, which I think are helpful and they'll help the conversation, and I'll add in information related to the slides as we go, if that's okay. So you've obviously got a picture of the team there. Within the team, there are some new colleagues within that team, and I think when I last came, Karen Stone, the medical director, was already in post. Since then, myself, obviously, I've joined now substantively, and Claire Hanson, who's the Chief Operating Officer, has also joined the team. So there are some key changes to the exec team leading the work around the CQC. I will just remind you, though, that we got the report in June last year. When I visited you last time, I think it was about July time, because I'd only just come into post when I last met with you. And just to remind you that the report that we received had the 95 actions in there, and there was a must do, and then 45 should do actions. Those were merged together, and I think you previously had a copy of the full action plan, which is of the 73 improvement actions. Happy to resend that if there's new colleagues that haven't had sight of that, but that's where we're up to. So that's the actions that we'll talk about today. The action plan for CQC is managed by the Journey to Excellence programme that is led by the exec team, and the programme oversight is chaired by Simon as chief executive. In the paper, it does detail the areas that are of focus, the key programmes. So we've got maternity services, governance, and that's both corporate and clinical. Programme that is led by the executive, and the programme oversight is chaired by Simon as chief executive. in the paper that it just entails the areas that are the focus of the programme. Nobody wants to hear their own voice.
Well, it's working.
Sorry about that. Don't think I thought I was having a moment then. Okay. So the third one is the urgent and emergency care programme. We have one around the well-led leadership and culture. Safe staffing is nurse safe staffing. Fundamentals of care, and there's some core areas under there, and then the elective recovery programme. And in the paper, we've given you some examples of actual practical things that have been happening, and there are many more. So as a programme oversight group, we do meet fortnightly, and the purpose of the group is that each executive director has got a number of actions allocated to them, and we are responsible for the delivery and assurance of that delivery. And we are really robust in the actions that we will sign off or not as an executive team. So you will see within the information that some of the actions we haven't signed off yet, and that is because we're not assured that they have been sustained. So there are some that have physically been developed. It might be an assessment document or a change in process, something like that, but we actually then monitor to make sure it's making the impact. So we are very challenging of each other as an executive team, because we want that assurance, because the whole point is to improve. And equally, the purpose is we will either extend an action if we feel it's warranted, or to sign them off to say that we're comfortable. You can see there, so far of the 70 odd actions, there are 40 actions that we've completed and signed off formally. We've got 8 actions that are now complete but are awaiting the next meeting, where we will approve those, or hopefully approve those. And we've got 13 with actions that have got extensions, and 10 that we know that are going to need an extension that will be agreed or challenged at the next meeting. I think it's really important, particularly on the member of the public, just to note the improvements that are in the paper. In the emergency waiting areas, the emergency departments are extremely busy at the moment, and we've put in additional nursing and healthcare support worker staffing into the waiting area, so that patients that do maybe need help, or signposts into the food and drink available in the ED department for those patients unfortunately waiting long periods of time, they can facilitate that. We also have volunteers who are working within the emergency departments, who again will facilitate patients being supported to go to the toilet, or for eating and drinking, those kind of things, because we recognise when patients are waiting a long time, their care needs move into more that you would expect in a ward area. Sorry. I think we're really proud of our referral to treatment times of 78 weeks have been removed as of March, and we're on trajectory for further improvements as we go through the year. We have had oxygen and suction points put in the bed spaces across particularly over at Scarborough and over at Yorkside. We've introduced the new patient safety incident response framework, the national framework, and that is working really well, and that enables us to learn in a better way and have better measured and monitored improvements that we monitor, and we theme outputs of that, which is much more valuable for learning and improvement. We've obviously got our new emergency care environments. We've got York has opened and Scarborough is imminently going to open, so that is amazing in terms for our public. We've got much better learning in place and structures in there for our structured judgment case reviews for patients who sadly die. And we've got a very robust and improved maternity improvement framework. I'm really delighted that we have got a national renowned director of midwifery joined the organisation as well, and she is key in us improving our maternity services. We're very lucky to have Sasha Munro-Wells join us. So you can see some of the images from the team. I always like to put images in so that you can actually see things in action. A key part of the work, particularly around fundamentals of care, is we've engaged with our frontline staff to have a year of quality. So every 2 months we have a specific focus. And so at the moment we're looking at end of life and palliative care, so that we spend a lot of time with teams focusing, engaging, and helping them to do, you know, programs of improvement, sharing good practice across clinical areas, celebrating, involving patients and using their feedback to make those improvements. And that's been a real change in the culture, I think, at the organisation. We work really hard at being visible from a leadership team, both at exec and through the sort of the layers of leadership, particularly nursing, midwives and AHPs. You can see in the paper, and I think I mentioned it last time to you, on a Friday we do a back to the floor day where all of the, well, not all, a lot of the senior nurses, majority, we're out on the floor talking to patient staff and checking that the information assurance that we are seeking and gaining is actually playing out for our patients and families. We don't always get it right, and we layer that into our programme of quality, a year of quality and improvement, and that's really important. We've been spending a lot of time improving our work around our nursing workforce, both from capabilities and competency and capacity. I'm really delighted we've got a healthcare academy established where we're able to invite members of the community to join our organisation on apprenticeships as healthcare support workers. They are supported in the academy, and then they're on a career framework up to me if they want to be a chief nurse ultimately. So that's really brilliant. We're rolling that out and looking at other professions within the trust as well now. It's evaluated really well, and I'm delighted with our projected vacancy going forward. That's really important for us. So yeah, so I think that's really good so far. I think we need to share with you, there's a page in the slides on our key risks, and we can't, I suppose, not mention the delivery of our financial efficiency plan is a real challenge for us as an organisation, and balancing that with the improvements we need to make. And you know, we're working really hard to make sure that the quality of our services are efficient and the outcomes for patients are good, because we know that they are more efficient financially as well. But the financial restraints do make us not run as fast as we would want to with some of our improvements, and we have to prioritise how we do that. Obviously balanced with the staff ability and capability to do that as well. I think because of the demands on the organisation, often sometimes staff engagement can be challenged because we are having to run under such pressure, and it takes some of the ability to engage as well as we would like to, and that can also impact on staff training. So we really are prioritising the training for staff that is absolutely essential to make them safe and effective practitioners. Excuse me. I think we can't, we have got some increase in quality of our estates, but the maintenance of our estates is tricky. We've got an ageing estate, and we've got some really brilliant areas like I've described, you know, the emergency care departments. Our endoscopy suite is fantastic. We've got some great learning spaces. We've got a new cancer care centre being developed end of the year, but we have got a lot of estate that is aged and is challenging for our patients and staff. We've got some challenges with our IT infrastructure and access to data, and that's tricky, and I think we're not unusual in our trust in terms of data sharing across the different systems. However, I would just like to say we're right in the middle of procuring a new electronic patient record, which we're doing in collaboration with Harrogate. So that's a really fantastic opportunity for us. And I do think, you know, we still have challenges about making sure that the public are confident in our services. It is really challenging in the NHS at the moment, and that is a challenge. And I think we have to just keep working really hard about letting them know the good things as well as the things that they see on the news and they experience themselves. So sort of next steps is to continue with what we're doing and continuing delivering the remaining actions in the CQC action plan. And then we're moving into actually looking back to make sure that we're assured as an executive board that the actions we've taken have been sustained and the required outcome has happened. Because some of the actions are focused for maternity or urgent emergency care, but actually they're appropriate for across the organisation. So it's sharing that learning across and looking back and making sure. So that's is one of the key next steps. The other part for this is about our ongoing monitoring arrangements. So, you know, I work really closely with CQC and meet monthly with them, with the trust, and then we also attend the integrated quality board monthly with the ICB, where CQC are there and regional, national members of NHSC are there to hold us to account on our quality agenda. So, you know, we enjoy sharing our journey regularly with people, and that's, you know, I think we're proud of the work that we've done so far. There's lots to do. That is not to say there's still not lots to do. And we've got the CQC visiting at the end of this month, so I actively invite CQC to come in and be critical eyes for us so that they understand the journey and they can see what we've achieved and then the pressure. So that's really helpful, and then they'll come and see maternity services in September with us. I think that's probably the key things. And just to note that towards the end of this financial year, we will be commissioning an external review of our well-led. But we're still on the journey of implementing the governance structure. So we'll commission that for Q4, so that we've got some external oversight of the progress we've made. So I'm really happy to take questions. I could talk on this to you all day.
Yeah.
But happy, I'll be quiet. I know we've limited time.
That's brilliant. Thank you for that. So I'm going to take questions from the councillors, and Councillor Runciman first, and then Councillor Wilson. Cuthbertson after that, yeah.
Thank you, Dawn. That was very interesting, and the report itself is interesting. Well, I think you've got one date wrong in there. I think CQC came in last year, not this year. What I want to ask you, you talked about must and should earlier in the report, and then you talk about 10 actions being off track. And I wondered if there were any musts in particular that were the actions that were off track. The shoulds hopefully are all underway, but
Yeah.
Could you just talk to us about that for a minute?
Yeah, absolutely. There are some must actions that are not necessarily off track, but we won't sign them off yet. So if I give you an example, one of our actions was for in the emergency departments that we developed an electronic mental health assessment. So we've done that, we've implemented that at Scarborough, it's just been implemented at York. We don't want to sign that off yet until we're comfortable that we've got the right performance of that being completed consistently. So that's an example of, there are some where it should, but we want to monitor to make sure that the staff are using it appropriately and then acting on those assessments.
Yes, sure.
When does CQC come back?
We don't know.
They do that, don't they?
They do. I know that they are coming back end of this month planned.
We have invited.
We've invited them
back.
Yeah.
One of the things about the CQC is that they've changed their assessment processes now. So they are spending some time working through how that works when they visit organisations, and of course they're also looking now at the wider system as well. So they've got quite a few things that they need to work through. They could be back at any time, but in terms of thinking about a further comprehensive assessment, there's still work for them to do, I think, to be ready to do.
Yeah, absolutely. And their re-inspections will be different to what we've had before. They will be very poignant. They will come and do one particular area. And they change their data set as data comes out, so it's fluid, so it could be any time, which for trusts is helpful because it means the ratings can be changed quicker. You're not waiting 3 and 4 years, and it's more realistic. So But we don't know. We don't know, unfortunately.
Thank you. Councillor Wilson.
Thanks, Chair. I was just wondering, reading about your examples of improvements and things like the registered nurse oversight of emergency department and food and drinks. They are obviously really positive improvements, but they do have cost implications. And given that one of the things that you're saying is the risk is the cost, I just wondered if they're fully sustainable or whether there's an end in sight when the money runs out, basically.
No, they are sustainable. I suppose as an organisation, you make choices, and you know the safety of our patients in the waiting area is paramount, and so we've made the choice to fund those posts in the emergency department. There are, you know, daily there are challenges, aren't there, with nurse staffing numbers, and you know we have a really clear safe nurse staffing policy. So actually, if we have got issues, then there's a structure that we will, you know, bring in nurse educators or matrons into to support teams. So they are in substantively, but we've got a process around when we've got gaps elsewhere.
Any other questions? Sorry, Councillor Benson.
Thank you, Chair. Thank you, welcome. This is your first meeting.
Second.
It's your second. I'm sorry, I wasn't at the first. I hope that things will go as swimmingly as so far this meeting has gone. I've got 3 questions relating to the last 3 items on your journey to excellence. You've got 8 actions complete and waiting formal approval. Is that likely to present any problems, or can you be kind of reasonably confident that having submitted them for final approval, it will go through?
The majority of the actions go through,
Yeah.
but we won't sign them off just because somebody's asking us to. We get very robust evidence to convince us as exec team that we want to sign them off. So the majority of the actions, when they come, they've had quite a lot of scrutiny already by the senior leadership team. Generally, we sign them off,
Okay.
but there are some that we don't, or we ask for further information.
Okay.
So yeah, so hopefully,
That's fine, understood. Your 13 actions with extensions approved.
Yeah.
Are those within your anticipated recovery time after the CQC report?
So
if you see what I mean?
yeah,
Have I
no,
made myself clear?
they've extended the action plan. So the action plan in its entirety,
Yeah.
if everything had gone very smoothly, should have all been finished by the end of June, and a couple in beginning of July, but the majority of the end of June. We've extended some on by a few months because we want to see that consistent audit feedback, really, that we're meeting it, because there's no point signing it off and then we're all comfortable we've signed it off. Well, we've met the performance and missed the point, really. So that's why. So some have been extended for a few months more.
And it is important to make the point that we're really transparent about that with the CQC. So it's not as though they're not aware that that's what we're doing. We talk that through in the Quality Improvement Board with the CQC and in the relationship meetings that we have directly with the CQC.
So that you're covering those in your keeping in touch meetings with I don't know if CQC calls them keeping in touch, but DFE do. So
yeah, no, we do. I mean, and we you know, because I think it's really important they understand why. Because, you know, they need to be assured that we're not just signing it off because the dates arrive. That's not the point. So, yeah, so everybody knows.
And the last point is the last on the list about the actions that are off track. Are any of these giving you any particular concerns in terms of the feasibility of ultimately delivering them? Or are there some technical or medical questions about whether you can achieve those actions?
No, I don't think there are any that I'm not comfortable that we'll achieve.
Okay.
Some of them are really like practical things. So if I give you an example, you know, one of the actions is that the maternity theatre was refurbished. And it has been, but the light broke when it was being fixed, when it was being put in. So it's delayed the theatre opening for a few weeks. And it's those, it's really practical things sometimes that stop something happening. So, but that's now been resolved, so that action's been closed, but we wouldn't close the action until we had the ribbon cut on the theatre.
I suppose what I was really asking was, you've got actions here that are off track and you're reviewing progress, but is there a point where you've reviewed progress and said, well, we've got as far as we can, but the next stage is slightly less determinate than we thought it was going to be?
The one action in there that probably I think we'll end up in a conversation about is the workload in the urgent emergency care, because that's the one that's tricky, and that's the one you can almost see that will struggle to ever close that, because at the moment the flow through of the emergency department is really tricky, and that's the one that, you know, we'll have to, but that's one we'll probably agree with CQC will become business as usual, and we'll put the monitoring, the governance around that into our normal board processes then. But the rest of them, I think I'm not particularly worried about any of them. I think they just need time to embed, and that's what we're doing for some of them.
Yeah, thank you. You made the comment about transparency, Simon. Thank you.
Thank you very much, and Councillor Rose.
Yeah, I've got two questions. The first was just, it makes sense to bring up the public participation comments here around the risk of COVID-19 and the impact on performance. And it's not obviously one of the key risks here, but it's something that permeates the way hospital operates the same as any other infection would. Are you able to comment on the points that were raised on the call, and in general the kind of ongoing impact of COVID-19 on patients and on staff and practices in the hospital?
Yeah, I think to do a response to the member of the public, it'd be helpful, because there was a lot said, so it'd be helpful to have that written and happily provide a response. What I would say, in the trust, we align to the national guidance around how we manage COVID, and that we do have patients with COVID still in the organisation, and we manage them as we always would. You know, we identify them, they're cared for inside rooms. We cohort patients. If we get a few patients together, they are cohorted. So we follow the national guidance. Some of that is challenging, because we still do have patients with COVID in the organisation, and we still get staff with COVID. But that's a challenge, because staff with COVID, you know, can still work in some areas. It's with the symptomatic, so it's tricky. It's still there. It's still there, definitely, and it just causes some, you know, care plans and decisions to make in the organisation.
And is there kind of specialist care plans on the opposite side of the fence for those who are particularly vulnerable? And obviously that includes people who are extremely unwell, and various generalizations, but also specifically people who haven't been vaccinated and haven't had the disease.
Yes, we would put additional requirements in and plans of care in for those patients. Yeah, and there's examples of that on our haematology ward. We would care for those patients in a very different way who were immunosuppressed to other patients. So yes, we would.
Thank you. And the second question I was a broader question, but I guess it ties into the comment made in the public comment as well, of doing what's required, and it ties into following the guidance maybe nationally and not necessarily going above and beyond. The statement around financial challenges, I think you've put a perhaps polite face on it today, that it is even worse than the council's financial situation, and it is a real struggle. And I guess that is a chronic challenge across all the things we're talking about here, and only doing what needs to be done then obviously causes greater cost down the line. There's all those kind of effects that we're all very well aware of here. I guess, are you able to speak a bit more to the financial challenge here, what we as a council can do to help support that? Because obviously the interactions between yourselves and the rest of healthcare comes across our side as well. And also whether you've heard anything, definitely too early to ask this question, but from the fledgling new government and from some existing continuing and new MPs, I know you've got a lot of touch points across them, but able to give a bit more of a broader kind of financial commentary, if that's all right.
Well, I mean, you'll be cited on our challenge in your role as a governor, so our challenge for this financial year 24-25 is to deliver a 7% efficiency programme. That's the biggest it's the biggest I've been involved in my time in the NHS, which has been sort of 5 years here in York, but 30 odd years in the NHS more widely. That's not unique. We're not unique at all. That's very similar to the size of financial efficiency that peer and neighbouring organisations in Humber and North Yorkshire, which is our integrated care system, also have to deliver. That does bring with it really significant challenges. I think, as Dawn indicated, we are doing everything we possibly can to make sure that whatever we do absolutely does not impact on the quality of patient care. But the point that you made about going above and beyond is a good one. I mean, obviously, our staff regularly go above and beyond, and we're obviously very grateful. We're grateful for that, but we do have to make sure. So, I mean, COVID's a classic case in point. You would do a risk assessment in that case, and there would be, I suspect, on the basis of that, very little evidence to go beyond the national guidance, and there'll be other areas where effectively we're having to manage services to those levels and not push further, because we're not able to push further with the resource settlement that we have. Just coming back to Councillor Cuthbertson's question, so one of the longer term challenges about sustainability will be ultimately, I think, about resource levels across the piece in healthcare, in health and care, because these things are interconnected. So Dawn's talked about the challenges that we face in urgent and emergency care, and there are absolutely issues that we are dealing with and need to deal with within our own organisation, but so much of the pathway of patients who find themselves in hospital through ED is dependent on what happens in the broader system, and all of our peer and partner organisations within that broader system have similar financial challenges. So it's difficult. It is very difficult, and there's no point pretending otherwise. In terms of the point about whether I've heard anything about any change, I mean, I haven't. I haven't heard anything. I don't know if you've heard anything on the grapevine. Dawn, it's very early. It's very early days for the new Secretary of State for Health and the new team, and we'll just have to wait and see. The first, I think, big challenge will be how we manage through winter. So when we get to September, October, November, and I suspect that's when all eyes will be on our leaders above to see how they manage that challenge across the system.
And the one of the 20 questions I asked that you didn't answer was, what would your ask be of us as a council? What can we as an authority do to help? Obviously, we know that the impact of the way the GPs and pharmacies and 111 impacts emergency services. We know the way that social care interacts with the hospital, all that other stuff. How can we alleviate some of the pressures that you guys are experiencing?
I think, as we are doing, really continue to I mean, it's true of both City of York Council, North Yorkshire County Council and East Riding Council, the three councils that we work with across our footprint, is continue to work constructively with us. We have good relationships. We have a health place board here in York, which my personal view would be it's one of the better ones across our ICB, across the six places. So it's just to keep up that work. I mean, but I'm equally cited on how challenging things are for the City of York Council as well. But that would be my ask, is to keep an open mind and keep thinking differently, keep innovating, keep thinking how we can better integrate what we do together. We don't have to change organisations. We can think about how our frontline services work better together.
Thanks, Chair.
Thanks very much. Are there any more questions before we go to recommendations? No. Apart from the recommendations that we have on the report, are there any recommendations from the committee at all? No. So as a committee, we're asked to note that the Trust's response to the CQC inspection and wider Journey to Excellence, a focused improvement programme, which is impressive. I think, you know, you're showing that you're doing everything you can within the constraints that we're all living through to improve things. And I know also that you were willing to speak with our public participant separately about the experiences as somebody with who's particularly vulnerable to or susceptible to COVID. That would be very helpful because
Very happy to do.
yeah, which would reassure other people having to go into hospital too. So that's something that we can exchange emails about perhaps. Yeah,
Absolutely.
but we can only thank you for coming along tonight and taking the time to speak with us and to answer our questions so comprehensively. So thank you very much.
Thank you.
Thank you. Bye bye. Okay, so we're now moving on to item 5 on the agenda, and we're joined today by Peter Roderick and Anna Lee Hughes from the infant feeding unit. Yes, here we're going to talk through the paper that they've brought to us on breastfeeding and infant feeding. So welcome to the committee and thank you for coming along. And we've also got Councillor Steels-Walshaw as well with us tonight, should we need to ask any questions too. So I'll turn it over to you. Thank you.
Well, thank you very much, Chair, and good evening, everyone. So we have previously brought a paper on infant feeding and breastfeeding to you, and it was back early in the year, and I think provided a really interesting discussion on the evening about all of this work, and some follow-up was requested, which is what this paper is. But some new things to bring to you as well, which I hope are quite exciting and interesting for us to discuss this evening. We are really expanding the work we do around infant feeding and breastfeeding in the city. And I think one aspect of that is having Anna with us, who has a background in midwifery and is our infant feeding lead and now works with the team to deliver a lot of the work that's described in the paper. So please be under no illusions that it's my work that underlies this. It's very much Anna's work that does. And there are 3 things really when we want to update the committee on. We want to update on our work towards, and we're not there yet, being a baby-friendly initiative accredited city, and meeting those international targets that many other cities have met and many other health visiting and school nursing services have met that we currently don't, but we have plans and aspirations to. The second one is around work that we're doing around the cost of living, and something that members raised last time that they wanted us to talk a little bit more about our approach to supporting particularly mums who aren't able to breastfeed and are also struggling with the really high cost of formula milk, and we probably are all aware that you know, that's been one of the highlighted issues of many, that that the cost of formula milk is really prohibitive for families on a very low income. And the third is to ask members to endorse an approach really that we want to take around feeding friendly cities. And again, something that committee asked for last time was some examples of other areas in other cities which had done something like this. So examples have been provided in the annex to the paper. I also have with me a presentation that was sadly going to be on a screen, but I don't think the room will allow it. So, Chair, if it's okay, I've got 4 copies. I wonder if I could circulate 2 either side, and then we can add the presentation to the minutes of the meeting as an item. Is that okay if I just circulate this? They're essentially pictures that go alongside my annex to give a bit of detail. Is that appropriate to pass these around?
Yes, that would be fine.
If I pass 2 down, thank you. So I'll get to that bit about feeding friendly cities, which are the pictures in there in a moment. But I'll do the first couple of points. So the first point was around our progress towards baby friendly initiative accreditation. The sort of, I guess the justification we talked a lot about last time, so I won't recap it aside to say that I don't think we probably don't think enough about breastfeeding as a public health initiative that saves lives and improves health. We probably, you know, don't rank it up there alongside tobacco, alcohol, all the other things we focus on, but it really does rank up there in terms of its impact on health. And I guess the most, you know, obvious but important to point out is that it improves health literally from day one. And in that sense, we know that health is hugely determined across the life course. And the more you can do right at the very start of life, particularly in the first 1,001 days of a child's life, from preconception to year 2, that's the most impact you will ever be able to have on that person's health. So this really does rank up there in terms of a public health priority. And it's a priority for the World Health Organization, has been for many years. So the idea of the Baby Friendly Initiative and UNICEF are the international organization that sponsor that, is essentially to make sure that all services that may come into contact with families and babies in the early years give as much opportunity as possible to support breastfeeding and to overcome some of the barriers. And what we see in York is a relatively high uptake of breastfeeding. Uptake is probably the wrong word, but a relatively high breastfeeding initiation rate right at the very start. And it's been brilliant to have our public speaker, Dr. Hurlestein, talk to this and support this, and to have her support with the infant feeding steering group in York. But absolutely right, we see initiation levels at that sort of 70-odd%, but actually that generally tails away quite quickly. What can we do to support that journey? And another aspect of it in the paper is that it doesn't tail away in an equitable way across the city. So it tails away in our more deprived areas to a greater extent than it does in our less deprived areas. So the idea through the BFI accreditation is to make sure that every service, the 2 anchor services, I guess, are midwifery delivered by the hospital and the healthy child service delivered by my team, but there will be other services as well, have a very clear evidence-based approach to supporting breastfeeding, including, for instance, a really good, well-trained professional support of specialist health visitors who know how to support mums who are going through particularly difficult feeding journeys, and if they wish to continue to breastfeed, you know, how we do that in the best way. It's, as you might imagine, you know, in a sense, that clinical intervention that needs to be done by those specialists. So the report lays out a little bit about some of the progress towards that, some of the work Anna particularly has been doing on that, auditing the sort of the state of play. Anna's been in post for sort of coming up to a year. Is that right? No?
December.
Oh, okay. So coming up to 6 months. So going around and essentially doing a bit of a baseline of where our services are and what needs to improve against the standards. The second thing is a food insecurity pathway in here. And we've been working for a year or 2 on this, and it's important to get it right, because I think, you know, one quite simple solution within a cost of living crisis is just to hand out a lot of formula milk. Without the right processes and scaffolding around it, that probably would be quite counterproductive to public health efforts around breastfeeding and infant feeding. So what we're trying to do is come up with quite a robust pathway that includes all of our partners, but does absolutely recognise that there will be some mums who are formula feeding. Some of those will not be able to to afford really quite expensive products, particularly at the moment. And essentially a voucher scheme has been the solution to that. So we're working with our partners to develop that. We have a pathway that is currently with York Trust Maternity at the moment for them to do their final signing off, so they're happy with it. And then at that point, we're looking to engage with all of our I guess, food delivery networks. York has members will know a real lovely range of networks around food and has a lot of crisis food provision. It's not just the Trussell Trust food bank delivery points. There are more than those, but they certainly are probably delivering the most food by volume every week. Working with all those organisations to have a really clear signposting in, and what then Anna and what our team in our Healthy Child Service would do, or midwifery would do, would make sure that that family has a supportive visit, has a supportive conversation, is supported to breastfeed as much as they can, and has the option of a Caris voucher for 2 weeks worth of formula food. So that's an update on that particular piece of work. And finally, before I finish and hand over for some questions, the Feeding Friendly Cities example. What I've done in that annex, or what we've done in the annex, is to provide a few examples, and those are what the pictures relate to. But as you can see, we've got some examples from Nottinghamshire. We've got some examples from Leeds, and their breastfeeding friendly scheme has been running for a decade or so, and is you will see the sticker on the 5th slide of the PowerPoint will be all over sort of shops and cafes in Leeds. You've got, very sort of public support around breastfeeding in libraries, in cultural venues. I think that's Leeds Town Hall. Bridlington breastfeeding project there to demonstrate. It's not all West Yorkshire, glad to know. Barnsley, breastfeed anywhere, anytime, and that's on a side of a bus stop. We've obviously got a little bit of control over our bus stops in the city through the advertising contracts, so the ability to be able to use them as a promotional tool for reaching people around breastfeeding and normalisation. That campaign is called Breastfeed Anytime, Anywhere. Thank you for breastfeeding cards handed out by health visitors and school nurses, and in libraries in Hull. The milk trail in Hull, essentially venues which are breastfeeding friendly, and cafes which will support and make sure that stigma and taboo is tackled. It's surprising the number of times people will object in public, and it's entirely inappropriate. There's absolutely no reason to, and actually giving people almost the power to say, no, actually, this is a place where that's absolutely allowed and is really welcomed. So that's the point of the whole milk trail. So just a few examples, and I guess to say to the committee, this is what we're proposing we do over the next year to two years in York. We've already started working a little bit on the comms around this. What would a York campaign look like? We're not at that stage of launch yet, so I'm afraid I can't give you a nice snappy name because we're not at that stage yet, are we? But we got some reference, yes. So we're on our way to working towards that, but having Scrutiny as a committee endorse that as an approach for the city would be really powerful, I think, and really help us as we look to engage with partners around that. So at that stage, I'll stop talking, and I don't know if I missed anything you'd like to add? Fantastic. So we're both here for any questions. Thanks, Chair.
Hey, thank you very much. Yeah. Councillor Cuthbertson, is it?
First, and then me?
Yeah, yes, sorry, I saw him first, sorry.
Thank you, Chair. Thanks for an interesting report. I'm just looking at the annex, in which you describe the work being done in 4 or 5 other cities. And quite clearly, there's some impetus behind those initiatives. My question is, what have we got in the way of results from those initiatives that says this is worth doing, this is the scale of the change we can make? I've got other questions I can ask later. I'll be really interested in that. Thank you.
Is that right? So I'll probably lean towards Hull because I know their results more, because that's actually the area that I've moved from. I think in terms of the breastfeeding welcome in the city, it's kind of everything linking together. So I'd worked there for a period of time, and it's just a part of the jigsaw. But overall, a sort of a sustained sort of move towards normalisation of breastfeeding within the city, after a period of time of having quite static rates, we really sort of put a lot of emphasis onto that, you know, the milk trust, things like that as a project. Also, achieving your full accreditation in baby friendly, so staff are more able to support families, so then families have better experiences, and then they pass those experiences on to their friends, and then it snowballs. And then also, and within that support, giving really good timely support to women as well when they needed it. With that impact, they've actually seen rates rise by 5% within the last 2 years, just from consolidated. So it is difficult to pinpoint which particular bit of an aspect makes the difference, because it's the whole thing combined. Similarly, the Bridlington project, I think, I don't have their actual statistics, but again, it's been that combination of things, starting off with, you know, the baby-friendly staff having those conversations with women in a timely approach, and then knowing that actually I'm supported in the wider community, because the woman, you know, often you can sit there and lay blame at the individual, but it really needs that sort of wider involvement of the community support.
May follow that up with a couple of thoughts. First of all, what about a nudge campaign of some kind? You know, thank you for supporting breastfeeding in our city. That's the kind of thing that the former nudge unit would have come up with. I mean, there might be a better way of phrasing it, I don't know, but that, and those are the notices that cost literally not very much to put up. And yet they do have an effect, because thank you for not smoking. I think everybody would agree that that's been a tremendously effective, how can I put it, psychological and motivator for people to give up smoking. I'm amazed at the level of non-smoking that there is, although I'm disappointed at the level of vaping that there is. And anyway, we'll forget that for the moment. The other thing was, I was wondering, is having heard from, I don't know if you're speaking on behalf of the university, Dr.
No, I was speaking kind of around behalf of
Right, okay. It just
because I work with them as well at the campus. Yeah. But the key point where I'm coming from is because I think for a long time, infant feeding has been considered as a mother's issue, and there has been a lot of challenges that hasn't been sort of the support structures have not been there. But the work I am doing with all the stakeholders, including the team here, is looking at holistically who are the stakeholders who really have an input into infant feeding. So it's like, well, we cross paths.
Good. Would you like to sit at the table by a microphone? That'd be better. Yeah. So you can there we are. If we need to ask you any more questions, that would be. Sorry, have you?
If I may, I'll try not to be too long, Chair. Thank you.
Okay.
I think the point of my questions is that if you were to provide formula for every mum who finds it difficult not to continue breastfeeding, it may be that that's necessary because of some problem in the process itself. Equally, it may be that the cost of providing formula on that basis would be prohibitive. So I'm just wondering if we've got a comparison of the costs. I'm not trying to be overly businesslike about it, but it just seemed that might be a factor worth looking at. And the idea of how could we get that knowledge out to people? For instance, first, second, third year female students might be, and their male counterparts, of course, might be a good way of getting that knowledge embedded in a certain section of the community, ones who perhaps were more likely to do something about it than others. I don't know. I just raised the questions because it may be that there is an answer.
Yeah. In terms of getting to education and things like that, on the delivery plan that we've got, the ones that we've chosen as a key are the ones that have been highlighted today. But looking at education in schools, education in other environments is something that we want to look at, 'cause as you say, there's a supportive people around it, or it's getting that information early, normalising it early on is going to be really beneficial. I don't know if you want me to add to that.
And Catherine, on this cost thing, this is one of those public health things where the return on investment is actually quite easy to calculate, because the investment of breastfeeding, I guess it is the staff time in it, but it doesn't cost anything. And then the free aspect of that versus, 13, 14 pounds for a cow and gates, sort of 5 litre, that type of thing is quite a lot. And it's interesting. I think we often, the nudge approach is a really interesting approach, and I'll take that away because I think it's a really great idea actually about how we frame these things. We have to recognise that, Anna and I and Ernestine and other sort of stakeholders are fighting against some of the world's biggest multinational companies who invest a huge amount every year. And although the advertising of up to 1 year is not technically allowed, there are lots of ways these companies get around that, but also one of the major ones is advertising follow-on milk, which has very little evidence actually, but essentially normalizes the company's name and the product's name into people's sort of imagination in that sense. So I think we do want to do everything we can to emphasize benefits on health, benefits on cost, to counter that message at the same time. And I hope the paper makes that really clear, that this is not in any way about stigmatizing anyone for choices that they make. This is about support. Ultimately, these are babies, they're very vulnerable age, but these are people often going through some of the most sort of vulnerable moments of their life, making huge, big decisions all at once. So, many of us will remember what it's like those first few months, and actually the support that we need to provide is what's key here. It isn't about telling people off for decisions they make. Actually, if you look at the evidence about why people stop breastfeeding, it is predominantly reasons that if they had the right support, they may not have gone down that road. So for me, it is about being aware of almost the actors within this who are maybe not with the best intentions. They'd like to make money out of formula milk, and how we can make sure we protect our population from that through things like, absolutely, like you say, reframing the nudges. Thank you for not smoking has been incredibly successful. So you're absolutely right.
Right.
Thank you.
Right.
Thank you.
If we could just go over to Councillor Steels-Warshaw as Director of Health, Wellbeing and Adult Social Care. I think she'd like to speak, just answering.
I just wanted to add something around the feeding friendly cities, and in looking at the reports of all the other towns that have developed these really, really effective ways, I think a really big thing that struck me was having within it actual families who'd had different feeding journeys, and they'd spoken about their different feeding journeys, and being really, really, really relatable. Because I think I've found, working with people, family attitudes within that are often huge, and a lot of people feed how their parents fed. So much of it within that is the education around their long-term health benefits and the changes it can make to the long-term effects and outcomes for those people.
Grandma's often really important here.
Absolutely, grandma is so important. Yeah. And whole communities and cultures within that often have beliefs around feeding.
Thank you. And now over to Councillor Runciman. Thank you.
I wanted to talk to you about the gap. You talk about in some communities the take-up is quite high. Can't really call it take-up, but in some it's very low. You talk about health visitors who, I'm sure, unless something has radically changed, all give advice about breastfeeding, and then the family hubs where I can't think that level of advice is available. So how do you pick up the people that stop breastfeeding and help and encourage them to raise the level of breastfeeding in those areas where it's very low? I just want to know how it's done, and whether we can asked to see an improvement in that if it's done well.
So, yeah, so I think that's it. It's often is reaching those families and getting them involved. So it's looking at, I think, definitely what recently Baby Friendly have changed the standards to a community standards to include the family hubs. So I've kind of paused progression at the minute to get the family hubs on board, in that all of their staff would be trained at a basic level in terms of signposting to know where to send people for information. And through that, from coming from midwifery, I found it a rather strange concept that they have a self-weigh, that mums can go weigh their baby. And then I thought, but what happened? How do they know what their baby should weigh? How do they know what to do if there's a problem? So I've created a poster that has all the guidance how to do it, and then some information for the website and how to tell your baby's growing without weighing, how to tell where to go for support if you're worried about weight. And what we're looking to do just as a start is to put those into areas where women go. So not necessarily, it doesn't have to be a children's centre that maybe parents don't go to, but it could be a toddler group in their area where they go. So I've been last week to Chapel Fields, which is where we've got very low rates, and spoken to the leaders there. I've been to New Ayswick yesterday, which is an area where we've got a really big, a good initiation, but a really big drop off, speaking to their leaders and keeping them on board. And once we've got a training package set up as part of this, they will hopefully come on as a breastfeeding welcome area. And also I'll keep them up to date with key messages and signposting, and they can tell me what women are bringing up to them as well. And also in terms of the food insecurity pathway, an awareness of that as well, because sometimes mums don't want to speak to a professional because they can feel a bit, concerned about referrals, but going to where their friends go, where their families go. So that's one of the ways. Within that work, we're hoping that we'll get to see families and have more insight and find out more things that we can do on that sort of scale. It's very much in its big infancy, and looking at how we can progress and how we can improve things in that time. I think one of the things is we're looking at as well is about some families, for them it might be too big a leap to do actually go to direct breastfeeding, but they might consider giving a first feed to a baby during the pregnancy. They might consider doing some antenatal colostrum collection to give to the baby, or they might want to think about expressing. So I've just put together some work to put forward about looking at the potential of as part of the food insecurity pathway, some pumps to support relactation if a mum's having a problem, so that she could actually reduce that amount. But looking at before that time, thinking in the pregnancy, okay, do you want to do those things I've talked about? Could we provide a pump which would maybe allow you to express for baby if you don't want to directly breastfeed, which could either be exclusively expressing or at least cut the costs, so we don't then end up in the scenario of needing the food insecurity pathway so much down the line, just to make it seem a more viable option for them to choose breastfeeding for their baby or giving breast milk for their baby.
Yeah.
Are you able to monitor which of the methods works best and then perhaps invest more time in that one? Or is that a very difficult thing to do? Because I know everybody reacts differently to even the thought of breastfeeding, unfortunately.
Yeah. Do you mean, just to clarify, which methods in terms of the expressing and sorry,
the talking to people, the
sorry,
the
interventions,
whatever.
Sorry. Yeah, so one of the things about the Baby Friendly initiative is very much auditing and finding out families' experiences of care. So as part of that, I think, especially if we're doing targeted interventions, we can tailor the audits to add on questions specifically. And so as part of the accreditation, it's quarterly auditing. And I think key, that's why I wanted to get into those other groups areas, so I can get to those women that maybe don't come up to the clinics and things. So, if don't always want the opinions of the people that go there, but maybe there's people that are harder to reach and get opinions from, and including in that probably also linking with the health visitors to get them to go visits with them and ask women the questions there to get their feedback.
Okay. Thank you. So, Councillor Wilson. And then
Thanks, Chair. Thank you. I've got a couple of comments and a question. So firstly, it's really positive to see the report come back with this work on food insecurity. I know it's something we discussed when you were here last time, that although the Trust have a really strong rule about not accepting formula milk and giving it out, that some of the more community based food banks don't have that same baby friendly training to know that that's something to be cautious about. So that's really positive. And it was also really great to hear you talking about making sure that mums are aware that there's other options. So I know that in the community, women aren't often aware that they can exclusively express and work. And I know that family members who've done that have then started talking about it on Instagram, and suddenly you get loads of people going, oh, I never knew that that was even an option. So I'm delighted that you've mentioned that, because I think it just opens people's eyes to how they can manage it in a way that works for them. So that all feels really positive. My first question was about whether, I know it's not mentioned here, but whether you're working with sort of voluntary organisations and charities that are always already working in the area to kind of use the expertise they already have. And then my second question is probably a bit more challenging, so I'll ask that one first and then
yeah, so we have a breastfeeding and infant feeding partnership group where yeah, if like Anna's team will sit on that, and also Caroline Wilson from Treasure Chest, and I've been to some of their meets, and yeah, so working really collaboratively with things that are already in place and where women go to, you know, to save on resources, not reinvent the wheel. We're all working towards the same goal, hopefully. So yeah, definitely into linking with them as well.
And my slightly more challenging question, because I'm not sure whether it's really under your remit or our first speakers, which is that so to be completely transparent, I trained as a breastfeeding counsellor many years ago. I don't work anymore, although I still support friends who send me messages about breastfeeding. And in that capacity as a friend, a number of women have still talked to me about their experiences in hospital, where you've got head ramming to get a baby to latch on, which we know is completely against advice on being baby friendly, and also means that they leave hospital feeling like they don't have the power to be able to get their baby on. And I think I've still come across that fairly recently in the past 6 months, where mums have talked to me about their feeding experiences in hospitals. And I didn't know, obviously that's part of being baby friendly, is making sure that midwives do it. And I'm really aware that when midwives have been interviewed, part of the issue is the time rather than lack of knowledge. And I just wondered if you had any further thoughts or plans about that aspect.
So obviously there is an infant feeding lead within the hospital, but very much part about going towards the baby friendly accreditation in both parts is interrelated work. And so I've actually been on a meeting with them today with the topics, which is part of the work that they were talking about earlier. And I think very much looking at where we can support that, like you say, I think, well, we're looking at some initiatives that we can improve where there is that inconsistency, because I think some describe very good care and support and others don't, and what things we can do to look at those inconsistencies. And part of that, the Bridlington project on there, I think they're looking to extend, which would give more it's difficult, probably not so much in the hospital, more, it does, we did talk about the Bridlington project gives more sort of support within the community setting. So that's good. And I did sort of relate to them a little bit about it would be good to have sort of specific workers within the hospital as well, because I think that is sometimes the problem with trying to, I've worked 23 years as a midwife in a hospital, so knowing when you try and you've got patients and then you've got to do that. One thing we found was that we actually were able to employ specific workers for feeding on each shift, and that made a huge difference and impact. And then what they did was they took the details of the women and signed them up and passed them over to community. I think in terms of the work in the minute in the hospital, it's a case of potentially financial restraints on that, but it's something perhaps to look at and work towards. In the interim, what can perhaps do is, if you've got more support working the antenatal period and the mum has more knowledge and understanding, and then they know they've got that support in the early days as well at home, hopefully it'll mitigate something, because I don't think everyone has a negative experience, and like you say, it might mitigate some things, and then yeah, that might support those issues. And also that if I come across those experiences, feeding back that as well. So we're aware of what women are saying, and very much involved with the MVP as well, so the Maternity Voices Partnership, and getting feedback, and they come to our meetings as well. So if there is specific stories like that, it's things we can learn from and feedback and work with. Yeah.
Okay, thank you. I'll put, you can just put Councillor Rose, and then I'll go to you, Councillor Knight. Thank you.
Yeah, I've never felt so chronically underqualified to ask questions as I do in this room, but it's never stopped me before. I've got three questions, two which make sense. The first question is, there's a commentary around the sort of challenge we've got with advertising at a national level and you know these big multinationals. Is that something we should be lobbying at a national level to change? Should we as a council be saying this is a genuine health problem that we need to do something about?
Well, it's, I mean, Councillor Rose, I think the answer is yes, and we are, as a country, there are sort of international standards that we have signed, and therefore, you know, for instance, as a public authority, we couldn't endorse certain products. So in that sense, there are those restrictions. For me, it's probably part of a broader point that a lot of public health issues we are battling against the commercial determinants of health as much as anything else. So we'd use the phrase the social determinants of health, and housing and education and the economy as things that affect our health. But we have started talking in the last decade or so in the public health community about the commercial determinants of health, the products which we know underlie a lot of ill health in the country, of which it's some of them are at that extreme end at which we absolutely can categorically say they have never helped anyone and should be banned from the face of the earth, tobacco being a really good example. Others at another end, I mean, food would be a good example where, you know, we all going to need food to live, but we know that some food products are not very healthy. And obviously when it comes to this, if we're talking about formula milk, for some families, I mean, speaking personally, we formula fed our third child and breastfed our first two. You know, without formula milk, our child would have had no nutrition and would have been severely, it wouldn't have survived. So, you know, formula milk is going to maintain its position as part of our ability to be able to keep infants fed across the world to a certain extent. But the way in which those companies push it where it's not necessary needs to be trenchantly resisted. And I guess without the marketing budget of Nestle, we are doing what we can through the supported networks that we have in the city to push back against that. It's not a criticism necessarily of the companies of the industry, just to say that if there are those forces that are influencing our families, we need to counteract them by efforts there. So for me, that's where our efforts are. And internationally, there are the WHO, I'd say, do the job of doing that lobbying for us. I'm not entirely sure that these companies would pay much attention to City of York Council making a big sort of steer out of it. I think we looked at people like UNICEF and WHO to do that, but we certainly add our voices as and where, you know, to national government, to things on infant feeding. And I didn't know if you had things to
I think there are things like Baby Milk Action that do lobby and do a lot of things which you can always go to, especially if you see things, marketing claims or selling in a way that's not appropriate and doesn't fit with the code of breast milk marketing, formula milk marketing, yeah, just to challenge those. They sort of tend to exploit the anxieties of parents, don't they? And hype up the prices on milks, which are supposed to be comfort milks or aid sleep or hungry baby and things like that with very little sort of factual evidence behind them. And there is an investigation into the forming milk pricing at the minute as well. It's going through, so I think keeping just an eye on what comes out of that as well would be useful. Just keeping sort of abreast of the information around. Yeah.
Thank you. My other question, it's a really good report, by the way, and the previous one was as well, and thank you for that. The feeling friendly city stuff, I mean, definitely endorse it. It looks really good. I mean, it looks like common sense more than anything else. I think it's interesting to see the other different approaches taken, and I know this is just a sample, but in there you've got Nottingham and Britain doing more generalised stuff. Anywhere in public from Barnsley, stickers for specific locations, Leeds, and then Hull having a bit more of a kind of planned route or similar. What's our thinking at the moment of all of those or some of those, or what's
combination? Stealing a lot of ideas. Yeah, I think there's very much we want to involve like the city and people in the city as well. So I have been to university and spoke to about things like the imagery that you see, the video content. Could they be involved in supporting us produce that? And then could that lead into them becoming a venue as well that's supportive and breastfeeding welcome? With the I don't know if that's on there, but it's on the milk trail. In fact, one of the things Hull did was the gazebo, and it's to take to events as a feeding space for parents, and it's adorned with artwork that was done by children in schools. And I just think getting the community involved in those ways will be really helpful. There's a thank you card scheme as well, which is what you have in venues, and you can give to a mum that you see that's been, you can pass it on to another mum. So I think a bit of a mixture of everything, really. But yeah, those are the key things that we probably like at the moment.
Thanks. I'll leave my third question because I still can't work out what I'm asking. So I could ramble for 5 minutes. You can unpick it, but probably not worth it.
So, Councillor Knight.
Thank you, Chair. Thank you. That's a really interesting report, actually. I do have an observation, I suppose, as much as anything else. Personally, I would love to see York flooded with really positive breastfeeding messages, encourage people, and that's wonderful stuff. My concern is there are many new mums who can't breastfeed, and there's a choice element, and that's fine. You can, when you see something, you can ignore or accept it. And I'm just wondering if that doesn't need to be accompanied by this is great, we encourage you to do this, feel free to do this, but if you can't. Because I just think that there's already a lot of mums who feel guilty. They shouldn't, but they feel guilty, even if they've got lots of support at the birthing stage, even if they've got lots of support with a health visitor. And I just worry what the impact might be of a big, flashy campaign to those mums who are maybe feeling a little bit more.
One of the things we've talked about as in the process of this was about, and that's why we haven't got the wording yet, is it, do we call it like a feeding friendly York? So it actually encompasses everybody, but with a heavy slant that we are supportive of that. Equally, because there's like, you get families that, if you go out with friends, you might have one that's expressing, one that's breastfeeding, one that's formula feeding. So just making it friendly, so there is awareness that actually of spaces that are friendly for families generally, however you're feeding your baby. Part of the baby friendly as well is very much about supporting mothers to safely breastfeed, looking at actually the relationship building importance of doing that, how you can do that in the best ways, thinking about paced feeding to reduce overfeeding. So making sure that mums feel that they're supported with that choice. In terms of if it is that they chose to breastfeed and that goal wasn't being able to reach, then there are other ways that we can do that. When I sit on a regional network for baby friendly, and one of those things is supplementary nursing systems, which there isn't. I've used them a lot in Hull. There isn't a lot of evidence around, so I'm actually doing some work in the regional NIFIN to give some guidance around. So that's one way. If that's not going to be something that they want to do either, then it's very, very important that one, that they feel like they've had all the support they've needed, and that's where that actually really good care and specialist support. So I've run specialist feeding clinics for 12 years, but as a IBCLC, so board certified lactation consultant, and we've just got, whilst I'm doing the strategic work in here, we've actually just appointed somebody in the Healthy Child Service to do that clinical work, so they'll be training up to that, and I'll be supporting them in those clinics. So we've got that specialist support going to come in place for those women where there are struggles. And if at that point still they've had those struggles, hopefully by having that communication and that connection, they'll feel actually it didn't go how I planned, but I felt supported, and I'm happy with what I've been able to, you know, to do and achieve. So hopefully all those things together will avoid those feelings.
Thank you.
Okay, thank you. I'm just have a couple of things to say. I noticed in the report, you talked about homegrown trainers, and also that in, I think it was Bridlington, that the parents preferred local support. And I couldn't help thinking that's such a good thing. And it made me think of like NCT, which is very middle class, educated sort of medium, but was very helpful as well, you know, 40 years ago for myself. And there was a possibility also to talk to women, breastfeeding counsellors, and you could ring them quite late at night as well, because that's the time when you sometimes, there's some sort of local support in more deprived areas. If you can get a few mums feeding and not having some sort of so much anxiety about it, and then being able to put, I think that seems like such a good way to encourage other people in a community centre. I don't know if you still have parent and baby clinics. I don't know if they still go on. You were talking about weighing babies. So much has changed that I'm so
So there is so peer support is invaluable to women. Speaking to your peers, the people that are around you that are doing it, already doing it. So there is, as we spoke about treasure chests, who are very involved with in York, run lots of groups throughout the city. So very much wanting to work along them. I think what they found is sometimes in the areas where we've got the low rates, it's a struggle to get mums to come to those groups. They don't want to go. For me, I think very much we need to get into those groups like what I was talking about, or have some, hopefully in terms of the restructure with Healthy Child Service, is have somebody that goes and does some specific impact work with women in those areas, then get those women to have those positive experiences, and then they become your peers that sell the story to other people. So yeah, very much it. In terms of, there's a consideration of interventions that like you were saying, like a text service, because actually a lot of people now like that interaction. They don't want to speak, and I've got a 22-year-old daughter, still have to ring the doctor for her, you know, she can't text it, she doesn't want to know. So it's like, so that's a consideration, and they could have a call back, or they could have a text conversation. And there is as well, like signposting, obviously something 24 hours. The Breastfeeding Network has just started a 24-hour service, which actually gives us a little bit of a reprieve, takes some pressure off me being awake all night. But so I think those interventions definitely are things that, to aspire to achieve and do as well.
That's great. That's wonderful to hear. And I was wondering about the food poverty issues and mothers in particular. I don't know. I know with the Sure Start system, there was a provision of food vouchers and things like that. And what worries me is, the mother must be well nourished and fed herself and that's a worry. That it's a worry in the 21st century. It's appalling, but it is a worry in our society. And what can we do about that, rather than, I think, you can give formula so the baby, but is there a way to incentivize people to come to things with, are there funds available for instance?
That one would probably be beyond my scope in terms of funding, but just to give some sort of input on that, I think there was a Maternity Action it's a national survey of 1,039 women, said 13% struggle to afford formula milk, 27% of those had cut out food for themselves, and 59% were returning to work earlier because of worries and that could impact on their feeding goals. So it very much is a challenge. Obviously, there is potentially, if they qualify for Healthy Start, they do get some money towards, vegetables and other products they could buy. In terms of the formula milk, they only get, I think it's £8. I think I did write it down, £8.50, isn't it? Yeah, £8.50 each week. So that probably wouldn't even cover your costs in terms of that. I suppose you could offset, but it's whether you actually are applicable to apply for that as well. In terms of the other things.
Yeah, and I think, Chair, for me, that's a broader point about how we support our city with financial inclusion, but it's a really good point because what we're trying to do through the pathway is not just say, okay, well, let's put formula in every food bank and have it available. You just take it and there's no wraparound support, there's no assessment of need. But actually, if our Healthy Child Service are able to be part of the support for the mum and say, okay, well, if there's a financial need, we can offer vouchers, but also how do we make sure that mum is getting good advice from the likes of Citizen Advice York and various other advice giving organisations around, are you getting all the benefits that you're entitled to? Are you maximising that income? Are you getting help around any fuel bill payments, debt issues, budgeting, all that sort of stuff. So I would hope that by having a good pathway in place, we're trying to make this as robust as possible, absolutely for the child, but yes, the mum as well, because as Anna was saying, if they're making decisions about their own nutrition in order to benefit their child, actually it's no good for them and wouldn't necessarily be very good for the child's health either. So having the robust pathway in place, we hope, means that no one slips through the net that they might have done in the past.
That's good to know. I think Councillor Seals-Walshaw wanted to come back.
Yeah, Peter has pretty much said what I was going to say, and it was about the food insecurity pathway, and that within that, yeah, absolutely, it's horrific that some people might not have enough, be able to feed themselves enough to be able to feed their baby. And within that, if people were on that, people requesting formula, I would really hope that people within that would be identified if they hadn't previously requested formula, and look at, as well as looking at whether they're on the right benefits, as well as looking at whether they're receiving the right money, and also discuss reasons. If you know that this mum has not previously been formula feeding, ask the reasons for the changes, reasons for that. And I think that all comes down again to being within these communities, doesn't it? Knowing these people in the communities, knowing what changes have occurred, which is why community champions are so brilliant, because they'll know more probably about the family than professionals who see a snapshot.
Yeah.
And
I think that's definitely, having them be the people that they feel like they can go to and sign first. And then equally, if the, like, especially maternity, they've been seeing that mum and working with that family and the Healthy Child Service, knowing some background as well is going to be helpful.
One question for Dr. C was, there's a breastfeeding week coming up, is that?
So we're hoping to sort of put some comms together. I've got to get my thinking cap on because I go away and we come around. So I just sort of said the other day to comms, we were like, oh, can you just create us something? So over the next few days, I'm going to be creating some comms. So hopefully around the key messages that some of the things that we've spoken about, and the theme for Breastfeeding Week is about gaps and actually about that society. So it actually fits really nicely. So it'll probably just maybe be something like a precursor to what we're endeavouring to do, and to kind of watch this sort of space really. It is the 1st of August, 1st to the 7th, isn't it? Yeah.
And
Yeah.
are you doing something in that space at all?
I am doing some work with the whole team around that time, but I was also thinking of doing another work with Treasure Chest, which will probably be hosted at the university. And the conversations with Treasure Chest, I was saying that because a lot of the things we've talked about today is majorly because mothers are not knowledgeable in terms of what are the options and how they could make informed decisions, and even the guilt you were talking about, because if they know pre-birth that these are the options, these are the challenges, this is where I can go for support. And if they are not able to breastfeed and they move on to a formula feed, they will know that it's not about them because they've had the information. And that's the biggest thing that is lacking currently, because unfortunately, we only see the people who are able to afford it, who will go to like NCTs and get that information. So people who can't afford to go to NCTs, particularly those in the highly deprived areas, don't have that information. So when it comes to post-birth, when you're talking about that support missing, sometimes they don't even know that they could have had that support, and they are not the ones that usually come forward asking for the support either. So we are missing them. So what the conversation I'm having with Treasure Chest is, rather than just get moms who are already breastfeeding now to come to an event and have chat with others, is to invite parents who are to-be, mothers to-be who are pregnant, to just come and chat about infant feeding generally, get some knowledge, know about the challenges which potentially they could face, know where to ask for support if they need to, and hopefully that will better prepare them when they get there. Even with the rising cost of living on infant feeding, some study I did in December, just around York, the impact of rising cost of living on infant feeding demonstrated that moms did not know. And as a result, it was just when they had the babies and couldn't afford to feed them, some of them were then trying to see if they could go back to breastfeeding, and it was challenging. So I think the most important thing is prepare moms pre-birth, and I think it will go a long way.
Thank you. Councillor Rose.
We'll have a go at it. We'll see if this works.
Thank you.
I think I'm talking enough of Peter's language that he'll be able to piece together what I'm actually asking him, I suspect. The reason I'm bothering to ask it, I'm not sure what I'm asking, is because I think it's kind of in the middle of the challenge. And I guess starting with, we've got some data around the percentage drop off from week 1 to week 5, significant drop off. And I guess broadly speaking, before, people are spending a lot of time in public places as well, so that there'll be limited things that can cause that. But the numbers are roughly ward based, and it's trying to get my terminology right. It's the breastfeeding percentage, not the breast milk infant feeding percentage. And I guess there are a few different potential KPIs you've got there, and you're not measuring at lower than ward level potentially at those sort of lower areas. How much does that data capture challenge, and I guess quantitative data in general, when we're talking about individual reasons for individual people, how much do we lack capturing that, and how do we turn that into the different reasons that different places have their challenges? Is it the same reasons in the areas that have a higher drop off, or are there different reasons, and how do we then use that to inform what the most effective strategy is? How do we do that data-led approach for something where the data is very vague and ethereal?
One of the things I've been involved with in the area where I worked before was definitely doing some insight data with families, and we were able to catch quite a large number of families through doing it with the health visitors, doing it with the midwives, doing it at events and clinics and things, to get that kind of feedback on what were the influences in terms of the feeding choice, what were their experiences during the pregnancy, what were the experiences in the first few days, and what was the impact. And I think very much that's something we'd like to replicate, because then that helps you to see that insight, that sort of like, you can do it in postcodal sort of areas, because even in your wards you've got very different extremes in your housing. It's very pocketed in York, isn't it? So I think you can narrow it down a lot lower to your sort of more communities, and you can see at what points those drop-offs occur as well, which is really crucial. It tends to be in the very early sort of days, where if it's problems, and later if it's more about that, oh, I've got to go back into the world now and I don't know that I feel sort of ready for this or comfortable with this. So I think, yeah, definitely a point is to do some more deep dive information and feedback of what those barriers and what those reasons are.
Great, okay. I think we've covered this and it's been really fascinating, and I can't thank you enough for coming along and talking to us and coming back, because I think you've already been. I hope you'll come again as well. Members today are asked to, the recommendations, note and support the work being undertaken to achieve our ambition of protecting, promoting and supporting breastfeeding and safe infant feeding practices. And certainly there's a lot of support around this table, and I hope some helpful suggestions too. And support the approach to York becoming a feeding friendly city, which I take it that Councillor Steels-Walshaw were fully on board with.
Yeah, absolutely.
Absolutely, yes. And it's great to see these examples of these different places and different approaches. I know from personal experience, this milk trail thing was a really good, there was a directory where you could look up places to go. This was like in the dark ages where, and it was just, you know, safe places to go that you feel safe in. So I think, you know, there's so many things in here that you're bringing together, and it's just great to see such a revival really of this approach. It's good. So thank you so much for coming along tonight and sharing this with us. I look forward to seeing you again. Thank you. Thank you, Johnson. So, thanks. Just let everybody. So, moving on now to the work plan before we finish. So, we've got page 45 of the agenda, the work plan, and our next scheduled meeting is the 11th of September. We did talk in the last meeting about having another meeting in August, but I think it's really too complicated to do that. And the issues that were brought up about the homelessness situation and the Salvation Army are going to be covered in the next Audit and Governance Committee, which takes place on the 31st of July. And that's the route that this committee sent the work plan through to go to that committee. So before it goes anywhere else, it's at the stage where it's going to that committee. So I wanted to address that because it was, you know, people feel strongly about it with good reason. And I don't want you to think we're just sweeping it under the carpet. We're not. So that's going to that committee. It is possible for members of this committee to register to speak at that committee as well, if they would like to. Just wanted to point that out. But we have to wait and see what happens with that issue. So that's, and then we can, you know, fit something into the agenda again, moving forward if that's appropriate. So, yeah, I think there's nothing really to discuss about this work plan at the moment, unless anybody has any points to raise about things that are already proposed for the next meetings. Councillor Rose.
Yeah, I mean, I've got a few comments. I think there are two different parts to the homelessness resettlement pathway. There's the one that we've got on the TBC items here, which is the future one, which came to the last meeting. And as I said at the start, my understanding was that was coming to this meeting. We said we couldn't discuss it fully and freely in the pre-election period, but we wanted it as soon as possible, and it seemed urgent from the officers and exec members' perspective as well. So that sort of evaporating until ANG have discussed a slightly related aspect of the homelessness pathway, I think is. I guess there's a cognitive gap there for me. I think that this could have been on this one. It should be at the next one if it's not at this one. And I know, appreciating that it's because of the election, but we've always had a lot on our list of things to talk about, and we're always trying to bring things forward wherever possible. So I'm quite surprised we've only ended up with 2 items on this agenda as well. And I just want to, I guess, express that. It's also interesting to see the autism and neurodivergent strategy again slip onto the TBC items when it's always been next meeting that we're trying to bring it up at, and it was something that was of significance at the start of the calendar year. And yes, it needs a bit of time for breathing room to understand where we're at progress wise, but we shouldn't be waiting for it to complete for a progress update. So those things, I guess I just want to express a bit of concern at things slipping. But we've had an eventful last 8 weeks, and there's a lot of reason for it. The other one on the same list is that it mentions LGA peer review. That feels to me a bit like a now or never item. It's currently timely. It won't be timely if we're putting it in the December meeting, or it will have lost its timeliness and efficacy. So yeah, I guess those are my comments on the things that are on the list. I've got another one that's not on the list that I'd suggest adding, but.
Okay, so I take all that on board. If you'd be happy for me to discuss that with the Democracy Officer and Councillor Bassey as Vice Chair going forward, and then so we may rejig the meetings, and it may be that September and October we have a longer meeting at that point. This has been quite short today, but I think we've actually covered an awful lot of stuff. It's not been. I don't think you can say we've skipped over things. I know the football is on, but some people might, yes. But I think we've covered both topics today, which warranted it in great detail. So I don't think we're and I think it's because the papers were published in the pre-election period, that has maybe caused issues with what's on the agenda. Sorry.
Thanks, Councillor. I just wanted to respond to Councillor Rose on the autism and the ADHD point, if I may, just in terms of the work plan. So we are planning to bring the outcome of the health needs assessment in November to this scrutiny committee, with then an intention to talk about the strategy at a later date. But in November, very much probably we'll do as precisely what you raised there in terms of an update on the writing of that strategy and a progress report on it. The reason we're doing that is taking some learning from North Yorkshire, who have been through quite a similar process recently, where not doing a thorough needs assessment prior to writing a strategy when that sort of unfolded was not received particularly well by, I guess, the community, we might say. So basing it well on need was felt to be really important. So that's why we're doing it in that order. But we can certainly talk about the strategy in November as part of that broader discussion on what we find within the health needs assessment, which my team are actively doing at a meeting on it today. So it is definitely in progress and underway.
Is that?
Yeah, I hadn't quite clocked the link between the health needs assessment and the strategy, and I guess it makes sense to horse before cart. I'll ask the question now. So it's a non-work plan issue, but it'd be good to know to what extent we're engaging with the relevant communities during that, and leaving it till November when we're at the tail end, I guess, of that assessment, to then know what we've done with that. Maybe there's some other conversation to have offline about it, but that makes logical sense to me.
Has anybody else got any issues with the work plan at all? No. Okay. Oh, sorry.
Well, I said there's also one thing that's not on here at all that I think maybe it's worth us considering adding. We're all well aware that adult social care is 80% of the council budget, or whatever the exact number is, and it is going to be the biggest thing for the future finances. And it's obviously we've got the financial performance monitoring on here. And in other committees, we have a bit more of a financial deep dive perhaps, but I wondered whether some of the areas that might need a bit of extra scrutiny might be worth bringing here. One that I know comes up in conversation often, whether it's accurate or not, is about people who are based outside of York, with complex adult social care needs and the way that we manage the cost of that and stuff. So it was just a question of whether there's something like when we've got the December finance and performance monitor, we bring a bit of a deeper conversation around certain areas of adult social care finance to that. It's a conversation we need to take offline again, but it's not represented on the items on there. And I just
And the adult social care strategy update, you don't think that would cover it?
I don't think that covers the management of cost necessarily, but maybe it does. I don't know.
Okay, and we'll look into that. Does it cover costs? Okay. Okay, so Councillor Cuthbertson, sorry.
I think I might not have been paying attention when we agreed to accept the recommendation in the report, but I'm happy to do it.
Okay, thank you. Thanks very much. Okay, if there's any urgent business of the committee? No? Okay, well, thank you. The meeting is over. Thanks everybody very much for all your contributions. It's been a very good meeting.